folks. My name is Guilherme de Souza, and today I'm going to provide you a general onboarding about our Face tool. I'm not going to treat today how to capture. This is going to be treated in another video. Okay, so let's start by having a look of what are the possibilities after we have scanned our patient. So, as you can see here, we have our patient in front of us. The quality is quite good. We have scanned her with an iPhone, a very common one. I don't want to indicate any type of device. You probably have your own already in terms of iPad and iPhone. In this case, we used an iPhone 14 for this scan, so this is kind more or less of the quality that you can expect. So what is it that we can do with the Face tool? So more or less we can do two types of things with Arbrea Face. One is to plan the procedure, and the other one is to simulate the possible result in front of our patients in a very easy and private way directly during the consultation or from the comfort of our home. It means that we can, for example, scan the patient, have our consultation and show to her or to him directly during the consultation, or for example, to send the simulation afterwards. It really depends on how we prefer to integrate Arbrea in our routine. So let's have a look at the tool. In the upper part, what we are going to do is to find the options that allow us, for example, to study the case. For example, we have the measurements tool. We have the possibility to have different measurements for different angles in order to study the case as much as we want. Especially, for example, if we need to do multiple consultations or if we had quite a busy week, these tools, they are extremely important between the consultation and the surgery because we can just go back and have a look at the case of the patient. We have the proportions tool, which is extremely important to show to the patient what we would like to achieve with a specific procedure or another. Okay, it's going to help us to explain to her or to him different options. Then we have, for example, the before and afters. In this case, for example, I already changed a couple of things on this patient previously. Okay, so as you can see, we have the reset button if we are not fully sure about the options here. Now, on the left bar, okay, which means here, I find all the options that are pre-made. So really depending on the case that we have in front of us, we can choose, for example, automatic options in order to promote some results, as you can see. They're not going to be possible to use in every case, of course. All human beings are different, but they come with a lot of options. They are going to be extremely important for us to show to different patients depending on the time. On the right part, on the other hand, we have some advanced tools. Especially important is the freehand tool, which is the possibility for us to directly choose what are the options that we want to treat for each specific patient. So if I want, for example, to sculpt a patient and to show specific results, the freehand tools are going to be extremely important for us, simply because we are going to be able to define exactly what we want to do. As we can see here, in the brush mode and then with the freehand mode, I can actually use it to simply sculpt what I have in mind in front of our patient. What about, for example, the other part of the face of this patient? What if, for example, we want to simulate a lifting? No problem. We can, for example, go here, select the view that better works for us in this case, and go on the freehand tool and select exactly the part that we have in mind, in this case for the lifting. We're going to draw exactly what we want to move and then click and move it. As you can see, the tool is quite useful, okay, in order to modify more options and more things in different patients. So the secret here is to practice. What we always recommend is more or less to decide what are the most common options, most common procedures in your clinic. Try them in a few patients that can be, for example, our friends or nurses or our relatives. Play with it a little bit and then start to use it with as much cases as possible. In any case, if you need, you can contact us and we are going to provide a more detailed training about our tools. The last mention for me is the one of the most important tools, which is this one, the vector tool, where we can, for example, use this directly to show to the patient different options, how they change, how millimeters change in our face, in her face, in its face. This is a tool which is extremely important to use. It helps a lot the education of the patient, and I do suggest you to use it a lot. Thank you again for your time. Have a nice day.